Hi, it's Janet Pope again from Room Now at the ACR 2017, and I've been doing hashtag Game Changers. So now I'd like to do 5 take-home messages from the meeting, and this is going to be limited to big data, RA, and lupus. So it's not game changers on everything, but in those areas. So in lupus, the Canadians put out SLE recommendations, and I think it's interesting to look at them. There's 14 recommendations. They're grade developed, so they're strong and conditional evidence, and a lot of them make good sense for following your patients and trying to make a diagnosis. And rheumatoid arthritis, we used to think that ACPA, or rheumatoid factor as well, were bad prognostic markers, and there's 3 abstracts in particular at this meeting suggesting that although ACPA positive patients in the first year cost more money from a US claims database, that ACPA from both a Canadian seniors registry, that's a claims database, and also from Europe, that ACPA positive patients actually don't look so bad when you adjust for confounders, and that they actually in the end might have earlier remission and more sustained remission, and time to remission is fast. With respect to safety, I think it's really reassuring that TNF inhibitors, such as sertolizumab pegol, which was the purpose of one study, was safe for pregnant moms, not found in the cord blood of the babies, and no unexpected abnormalities in the kids. Whereas if you were going to stop a drug such as Cimzia and put a patient on a pregnant mom, on prednisone, you can actually have a lower birth weight child and earlier term. So the safety of the TNFs, particularly Cimzia, is really reassuring. For use of big data, there's 2 take-homes. Patient devices can be used in big data, such as patients walking around. When they start walking less, guess what? They're having a flare. So there's all sorts of ways of finding big data if patients are reporting and have their own cellular device to report things. The last thing is computer learning for referrals. You could actually screen referrals from a computer that can be trained to have about 80% to 90% specificity of differentiating inflammatory arthritis from osteoarthritis, and that's from a Canadian study that I was part of. I'm so glad to be here. Enjoy the rest of the meeting.